I'm Dr. Stewart, consultant and lecturer at the University of West Indies. I'm here to speak about uterine prolapse. What exactly is a prolapsed uterus? This refers to descent of the uterus into the vagina and in severe cases through the vagina. So what are some of the signs of prolapse? Persons may actually see a mass coming through the vagina or feel a mass when they wipe after passing urine. So they can palpate something coming through the vagina, or they might feel a sensation in the vagina, dragging sensation, or pain in the lower back. Or some persons complain of urinary symptoms such as difficulty passing urine, or they might actually wet themselves without trying to pass urine. So they leak urine and coughing and walking. Any pressure in the pelvis leads to leakage of urine. Sometimes it's constipation, difficulty passing stools. So these are some of the common signs. So what are some of the causes of uterine prolapse? Anything that increases the pressure on the pelvic floor, the muscles and the ligaments that support the uterus and weakens it will cause prolapse. The hormone estrogen, or the lack of the hormone estrogen, will lead to prolapse. So in menopause, as age increases and the hormone decreases, there's a risk of prolapse. Anything that increases the pressure, for example, a mass in the abdomen, for example, fibroids, will put pressure on the pelvic floor and weakens it and lead to prolapse. Chronic cough, so persons with chronic cough will constantly put pressure on the pelvis and again, prolapse. Other risk factors include childbearing. So pregnancy by itself leads to an increased risk. However, the way you deliver can further increase the risk. So vaginal delivery, persons who deliver vaginally will be more at risk than a person who delivers by a cesarean section. Again, during the process of delivery, persons who deliver big babies through the vagina are more at risk than a person with smaller baby. Persons who experience trauma during delivery are more at risk also. Persons who have had surgery, for example, removal of the uterus, they are more at risk for prolapse as well. Increased body mass index, so your weight, excess weight leads to an increased risk. Now, how are some ways we can prevent prolapse? Or how are some ways we can treat it? Well, prevention, of course, is always the best. But there are some things we can't prevent. But things we can prevent, for example, if we have a chronic cough, for example, we can decrease the pressure on the pelvic floor, so we treat the cough. If we have, in terms of heavy lifting, so if you have a job that you have to lift stuff, the way you lift, the mechanics of lifting can make a difference. But if you can avoid that totally, that would be the best thing to do. The other way is you can use the hormone estrogen. So persons who are menopausal, they can be given hormone replacement therapy, and that will reduce the risk as well. Now, for the person, and there are exercises that we can do. The Kegels exercise, we commonly hear about that helps to strengthen the pelvic floor. But there is also help from a specialist, so the physiotherapist can help you to exercise the pelvic floor, and that will give additional benefit. Persons who do not benefit from these ways can use support mechanism like the ring pessary. The ring pessary is an object placed in the vagina, and that will keep the prolapsed uterus in place. There's also surgical procedures that we may use for persons who fail all these other methods or with severe prolapse. And the surgery varies depending on the stage and the symptoms of your prolapse.